It's just this pouch here for holding the testes. Pretty much what it is. The spermatic cord is this cord that comes up from the testes and epididymis up here. It includes the ductus deferens, or the vas deferens as it used to be called. So when you had a vasectomy, you were going to have this part cut and cauterized or whatever, so no sperm could get through. So it's the ductus deferens down here that actually conducts the sperm itself, but the whole spermatic cord has tough connective tissue around it, some muscle, it's got some nerves and blood vessels and so forth in there. So quite a bit of stuff all together, and then the ductus deferens is obviously the main event going on in the cord. Here's the testis right here, producer of testosterone and sperm. The epididymis sitting on top of it like a little beret, and that's where the sperm are going to be matured. A lot of the extra fluid is going to be soaked up because there'll be plenty more places for fluid to be produced later on. So, okay, up along through this little tube in the middle of the spermatic cord, the ductus deferens, and then eventually it comes around through here, round the back of the bladder, and this is the so-called ampulla of the ductus deferens here. It's going to be joined now, in terms of contents, by 3 sets of glands. So 2 of them are paired and 1 of them is just an individual. So first we're going to meet the seminal vesicles or vesicles. They're sort of located on each side of the bladder. This one's shown kind of cut open there, and they provide about 60% of the seminal fluid, and so they're going to put their contents into here, and now we've got seminal fluid from the seminal vesicles and the sperm coming in. So now we've got a separate little piece of the anatomy that we're going to give a different name, even though it doesn't seem very significant, which is this little piece here is called the ejaculatory duct, which is a sort of fancy name considering the main duct of ejaculation is going to end up being the urethra, but that's, the ejaculatory duct just refers to that a little bit. And then the urethra is going to be used for the sperm to touch.
That's right after the...
It's right after the seminal vesicle and the ampulla of the ductus deferens join. Then they've got a new name, kind of like the vessels when they join, they get a new name. You know how it goes. So somebody had to get in there and name something. Well, there still was something to name. So then we've got the prostate gland. Here it is shown kind of from the outside, and then it's just a single gland. It's like a donut with a very tiny hole surrounding the urethra at the bottom of the bladder. So if you have prostate problems, that's going to squeeze and that's going to make it hard to pee. So if we look in here, we can see that here's the urethra coming down right through the middle of the prostate. So there's just one prostate gland. It also provides nutrients and other fluid to the whole contents, to the semen. And then the last little pair of glands, the bulbourethral glands, small little pea-shaped glands down here. Here's where one of them is. So bulbourethral is because, well, they're near the urethra, they're also near the bulb of the penis. You might think the bulb is this end, but actually the bulb is the base. So they're near the base of the penis, near the urethra, and so bulbourethral seems like a mouthful, but there it is.
Are those also called the Cowpers?
The Cowper's gland is the old name for them, that's right. And they provide mostly alkaline mucus, neutralizing the acid of pee is necessary to make sure those sperm are happy, and so that's going to pave the way for them, kind of help to neutralize the acid. So then, we've got the penis here, the shaft. That's obviously the shaft is this part. The glans is the technical name, with an S, not a D. Glans is the technical name for the end of the penis here. The foreskin is what gets cut off if you're circumcised, so obviously this person was, because there's no foreskin remaining. So I guess we can't label that. And then we got the corpus cavernosum and the corpus spongiosum, which we've looked at in cross-section. So the corpus spongiosum is what's going around the urethra, and then the glans is mostly the spongiosum, as this picture shows here. And then here's the corpus cavernosum. There'll be 2 of them. That's the erectile tissue where the deep artery is. And then we already saw the urethra. Basically, we've seen it a couple of times, but there it is. And urinary bladder right here. So in the male, pretty easy to put sperm out through the urethra, but in the female, going to have 2 tubes because having a baby through your urethra doesn't sound like any. I mean, it's hard enough as it is, but that would really be too much. So
this is the prostate, the outside of it.
oh yeah, that's the outside of the prostate. Right, there it is cut through, and there it is, well, part of it seen kind of at the base of the bladder. The dark, this liverish color, purpley thing, right.
Okay.
I doubt that's its real color, but anyway, maybe it is. Okay, so then we're going to go to here. Okay, so in the female reproductive, we've got the mons pubis. Mons is a mountain or a mound. Here's the pubic bone. Pubic symphysis is around here. So this is just the pubic area, obviously, and just a little bit of extra padding there in that area. The labia minora and majora. Majora would be the major, the bigger one. That's these 2 structures here. And then we'd have 2 more kind of going on the other side like that. So this is like half of it. So you'd have a pair of the bigger outer labia majora and a pair of the smaller inner labia minora. And then we've got the vestibule, we've got the vaginal opening here and the urethra coming in here. So a vestibule is like a sort of common area opening down here. So since they both open separately, that's what we're calling a vestibule then. It's like one of those little hallways you come into where you take your boots off and then you go into the main area of the house. It's like a little common halfway outside area that's there.
Atrium.
Yeah, a little atrium, right. So it contains vagina and urethra and the clitoris, the stimulatory organ for the female here. Then we've got the uterus, and it says that it has the fundus, body, and cervix. Really, the fundus and body, if uterus is going to be on there, then I would say you can put uterus if it's up here or down here. But down here, where they've given it a separate number, 11 for the uterus compared to 12, this is the cervix area down here. Cervix means a neck, like cervical vertebrae, so this would be the little neck region of the uterus. So that would be the cervix. And then we've got the ovary and the fallopian tube. So here's the ovary, this yellow job here corresponding to the testis. It makes estrogen and progesterone for hormones, and it makes the eggs. And then we've got the fallopian tube, which is similar to the ductus deferens. And this little part here isn't really attached like the epididymis. It's more like a sort of funnel, maybe vaguely attached. But it's so the ovary ovulates, off comes the egg, and the job of the fimbriae, as this little part is called, is to sort of catch the ovum and direct it down the fallopian tube to the uterus, and so off it goes down there. So the fallopian tube is, commonly fertilization occurs there. People don't think of it as a place for fertilization, but it's actually quite common. What is rare and very uncomfortable is to have a tubal pregnancy where it actually implants, but that shouldn't happen, and it should come down here and implant. Hopefully we're in the secretory phase by the time it gets down there and it's all ready for implantation. And then we've got the bladder and urethra, and that's it.